Hello and good evening, everyone. We're just going to wait for a couple more minutes for more people to join in, and then we will start with our today's conversation. All right. Good evening, everyone. I welcome all of you to the Frontliners. It is the new Facebook interactive live series that Sancheti Hospital and Healyos has brought to you. In this series, we are going to get prominent people leading the management of COVID 19 and have a conversation with them as they share factual and relevant information about the pandemic. The very first step of being face to face with the pathogen that is getting tested, and that's why we have decided to start this series with our first episode on COVID 19 testing. And our guest speaker for today is Mr. Nickhil Jakatdar, the CEO of Genepath. Mr. Jakatdar is a serial entrepreneur and he has received numerous awards, including UC Barclay's Innovator Award and the College of Engineering Pune's Lifetime Achievement Award, amongst others. He has, to his credit, 60 patents and more than 20 journal and conference papers. Mr. Jakatdar has had an interesting journey from being an electrical engineer, founding, financing, and leading multiple tech companies, investing and advising 40 plus startups, to being a CEO of Genpath Diagnostics. So, Genepath Diagnostics is a path breaking company based out of Pune and the US, which aims at bringing state of the art in vitro diagnostic tests to the Indian medical community and to develop novel, high quality, affordable molecular diagnostic tests and platforms for the developing world. Genepath has been at the forefront in the war against novel coronavirus, being one of the first diagnosis centers to start COVID 19 testing and starting the first COVID 19 drive-through testing center in Pune. So let's all welcome Mr. Nikhil Jakatdar to our first episode of the Frontliners about COVID 19 testing. Thank you for joining us, Nikhil. We welcome all of you to our first episode. And I know it is really early in the morning for you today. And thank you so much for taking the time out and joining us today.
Thanks for having me, sir. I'm excited to be on the call.
Same here, same here. All right. So before getting into the conversation about whole COVID 19 testing, I would like to know it's an interesting journey from being an electrical engineer to being a CEO of a Genepath, which is a medical diagnostic and a genetic diagnostic center. So how has that journey been? Can you tell us a bit about that?
Sure. So, yeah, I trained as an engineer at COEP right there in Pune, very close to Sancheti Hospital. And
Right.
I went abroad, came to the US for my master's and PhD. Um, for the last 20 odd years, I've been an entrepreneur in very different spaces, semiconductor manufacturing and chip design and, mobile video. But about 5 years back, my mother was diagnosed with cancer. And so for that reason, I would spend a lot of time with her in India and be together with her as she was going through a treatment. Through
Right.
that process, I connected with a friend of mine from my school days, Nickhil, who lived in
Right.
Pune, had also done his PhD in the US, moved back to Pune to do something novel in the area of molecular diagnostics. Um, and so he was very, very helpful to my mother.
Right.
And in the process, I also got to see the power of what molecular diagnostics can do in treatment, in first in
Right.
diagnosis and then eventually in treatment of patients, whether they have cancer or they have infectious diseases or they have genetic disorders. And so we got talking, and I realized that when it has impacted someone so close to you, it's not
True.
enough to just sit on the sidelines and be a critic. It's important to be part of the fight. And so while I don't really have the expertise, but my friend Nikhil Padke, he has the expertise. My job was to come in and take all the experience I had starting and running companies and
Right.
working closely with him. So I really am there to provide him support in whatever way is needed to really scale this and make this not something that impacts tens of lives or hundreds of lives or millions of lives. So that is the reason I got into it, and I'm really glad I did because the timing couldn't be better.
Very true. And that is such a noble thought. Uh, So moving on to the next question, Nikhil. So what about the current crisis in the country and in the world worries you the most, and what gives you the most hope?
Yeah, these are interesting questions because this is one of those times where the pandemic has, brought the world together in many ways better than almost anything else. But at
True.
the same time, it has also exposed, when people want to find ways to come together, and when there are people who will still use this as a money-making opportunity.
Very
And
true.
between there gives you the hope and the worry, because the only way to address something like this is when the world's best minds come together, think together,
Right.
and apply everything, their thoughts and brains together. And it's happening in a huge way. I mean, the way the vaccine is being developed, the way standards are being put in place to deal with this pandemic, the whole approach. I mean, I was very impressed with the way India went through the lockdown process. Now, there is no perfect answer, right? I mean, there have been lots of implications of that
True.
lockdown process on people's lives, and it's not easy. But hard calls have to be made, and I think in that way, I think we are better off today than if we had not gone through the lockdown. So that gives me hope
Right.
that we're willing to make the hard decisions, right? But
Right.
what also worries me is, because this is not an easy crisis to overcome, it's going to take time. And I'm beginning to see that there is a lot of um, people who are trying to make decisions based on hope rather than based on doing the right thing. And I think the bottom line is that we are all tired of the virus, but unfortunately, the
Very
virus
true.
is not tired of us, right?
True.
And so, as long as we do things in a certain way and not get carried away, I mean, the number of WhatsApp forwards about how this magical thing has come and is going to cure everything,
Right.
that needs to be stopped, because otherwise it gives people wrong hope, false hope, and that
Very
leads to
true.
more problems and good things happening.
Very true. And that's precisely the reason why we decided that we should start with this interactive series where we're getting factual information to people, because at right this moment, I guess that's the most important thing, that everyone is aware of what exactly is happening. And on
Yeah.
that, related to that is my next question. Slowly, India is coming back to normalcy. A lot of businesses are opening up. The Unlock 3.0 is in action. Uh, but the situation at hand is nowhere close to getting better. So, just to make our viewers understand the gravity of the situation, how alarming is the COVID-19 situation in India, and what should people keep in mind while everything slowly returns to normalcy?
Yeah, I think the situation in India is not good. It could have been worse, but that's
Right,
not
right.
good enough reason to be excited. I think it
True.
could have been worse, and a lot of things that have been done have helped. So that's like I said, the good news. But we are still far from the returning to normalcy in the truest form of the word.
Right,
I think normal is still a while away, but that's okay as long as certain basic practices are followed. And those basic practices include all the way from test regularly, um,
right,
if you are in a situation where you may have been exposed, to wearing masks, to maintaining the appropriate social distancing. I mean, there are ways to have fun without being dangerous. And
very
I
true.
think it's things like that that will allow us to come to normalcy. It's when people accelerate the return to normalcy just because they would like it to, not because that is the right thing to do, is when
Very true.
problems happen.
Very true. Before getting into the whole testing and what's the process of it and what is the situation of testing in India, what I have observed and all of us have observed, there is a generalized sense of fear and confusion people about getting tested. Uh, have you? What is your thoughts on this and what is your take on this? Why is that confusion and why is that fear about testing?
Yeah, I think this is a real issue. There are a couple of reasons why I think there is all this fear and confusion. I mean, there are both, and you're absolutely right. I think the fear comes from the fact that when people who come to test you come in full PPE gear into your building complex, it
True,
just
true.
freaks everybody out.
Very true.
And nobody wants to be, treated like an untouchable. And
Right,
so that's where the fear comes from. The other part of the fear also comes from the fact that, what's going to happen to me if I'm positive?
Right.
and it almost gets into the mode of I'm better off not knowing I'm positive, right? It's better
Right.
to be ignorant than
Right.
be aware, which
Right.
both of them, of course, are wrong things, right? But they cause a
Right.
lot of fear. The confusion in my mind comes that I've seen comes from the fact that there are a lot of different tests out there. There is
Hmm.
the RT-PCR test. There is an
Right.
antigen test. There's an antibody test, right?
Right.
And each of them have their pros and cons and where they can be used and where they cannot be used. But
Right.
I don't believe a good enough job has been done to explain to the general population what's appropriate when. And maybe I can, if needed, just talk about it right now. Saurabh, should I do that or should I keep
Yeah,
that
yeah,
for later?
for sure, because this is something which people need to know.
Okay, so the RT-PCR test is a test where they take a swab either from your nasal or nasopharyngeal, so they stick something up your nose.
Right.
How deep they stick it up depends on whether it's a nasal swab or a nasopharyngeal goes even deeper. You almost feel
Right.
like they're scrubbing your brain. Okay,
Wow.
it's very uncomfortable. The nasal swab not as uncomfortable. And then
Right.
they also, in some cases, stick a second swab down your throat. And the whole
Hmm.
objective is that they want to try and get whatever virus is there in your system onto the swab, right?
Right.
And then the RT-PCR test is done to detect active infection, whether you actually have an infection right now or not. Okay?
Right.
It is considered to be one of the more accurate tests.
Mm-hmm.
The sensitivity is more than 90%. Okay?
Okay.
Uh,
Hmm.
Now, having said that, it also depends on what type of test they use. Depending on the different companies' tests they use,
Right.
that sensitivity can vary quite a lot. Okay,
Okay.
and so sort of whoever gets tested, go get tested at a place that has a very good reputation for high
Hmm.
quality. I would
Right.
not go to a general lab because today, like every other time, there are people who try to make money in this situation without providing good quality. But
Very
in
true.
general, the RT-PCR test from a good lab is a high sensitivity. The downside is it is not cheap, right?
Hmm.
It costs about 2,200 rupees, uh,
Right.
which over time has to come down in order for it to become more affordable to the general population. It takes
Right.
about 24 hours to get a result,
Hmm.
but it is sensitive. So that's how a RT-PCR test works. It is
Right.
considered the gold standard. I mean, if I had to do it for anyone in my family or friends, I would absolutely recommend the RT-PCR. The
Right.
second test is an antigen test. Antigen test is also to detect active infection. So it's a
Hmm.
sort of a comparison to this first RT-PCR test. It is less sensitive than an RT-PCR test, which means there's a chance you may be positive, but you may be called a negative. Okay?
Right.
There's a
Right.
reasonable chance of that happening, and
Hmm.
so it's not very sensitive, but it is quicker. You can get an answer in an hour or maybe even sooner,
Wow. Okay.
and
Hmm.
it is cheaper. It probably costs sub 1,000 rupees. Okay,
Right.
uh, but again, you're giving up accuracy for speed and cost.
Right.
And like I said, to me, it's not a good enough trade off at this point in time. As it gets more sensitive over time, maybe it will be.
Right.
Or maybe you just need to do this more often, right?
Right.
And not a very sensitive test done often enough is also okay. But then the cost factor goes away, right? Because then you're
Very
spending.
true. It'll always come to the same.
Right, exactly.
Right.
And then the third test is an antibody test. An
Hmm.
antibody test is different in the sense it's not used to detect active infection. It's
Hmm.
used to detect if you had infection in the past or not. Okay.
Right.
So it's not going to help you. It's not like should I do RT-PCR, antigen, or antibody? It's should I
Right.
do RT-PCR or antigen for active infection and antibody for post-infection to just to know whether you ever had it or not. Okay.
Okay.
Right.
And for the antibody, sorry to interrupt. So what is the time frame of that? So after how many days of you having an infection in antibody test, the positive results will show up?
Yeah, these are all again questions which unfortunately don't have very crisp answers. But
Right. Right.
in
Hmm.
general, the anti gen and the RT-PCR are typically valid from maybe a few days after you got contracted the
Right.
infection
Right.
to maybe, let's say, 10 days. Okay.
Understood.
After 10 days, the amount of virus in your body is going to start going down, and so it's not going to be as accurate.
Right.
After about 10 days to or so, the antibody actually within 4-5 days it starts taking off. But in that 4-5 days after the infection to maybe as long as for till the time you have antibodies in your body, it
Right.
should be able to
Right.
tell you. The challenge right now is people don't completely understand how long these antibodies last. Okay. And
Right.
so that's still an area that will become clearer as time goes by. But the general rule of thumb is first week or two use the antigen or the RT-PCR. After that,
Right.
maybe a week onwards to 2 weeks onwards, look at the antibody.
Understood. Thank you so much for clearing that. Even for me, this wasn't so clear up till this point. So another question I have about this is, as a common person, does a common person have a choice that which test they want to go for?
Yes, absolutely.
Okay.
The common person has the choice. Unfortunately, it all depends on what they have been told by their friends, right?
Right.
And
Very
hopefully,
true.
sessions like this allow them to make the right choice, right?
Right.
Because there's so much amazing amount of wrong information about tests. I've been asked by people I know very well about, hey, this antigen test is so cheap, can I just do it? And
Right.
yes, you can, absolutely you can, but you must walk in knowing that just doing that antigen test once, the chances of it getting a wrong result are much higher, right? And
Understood.
so unless you have a plan to do it 3 times, which most people don't have a plan to go get tested 3 times, if you
Of
have to do one
course.
test, do a PCR. If you are in a role that requires you to get tested on an ongoing basis, right now PCR may be expensive, then
Right.
do the antigen, but then do it regularly, right?
Right. I guess you've made it crystal clear for all our viewers to make a wise decision whenever they decide to get themselves tested. So while we are on the topic of getting tested, there's another area where all of like most of us are very unclear about what is the process of getting tested. If I want to get tested, what is the process?
Yeah. So actually, the process is relatively straightforward. Okay.
Hmm.
Um, so there are, let's take two categories of people. One who are symptomatic, they're feeling all the symptoms
Right.
and they're suspecting they have it. And then there are others who are completely asymptomatic. There's nothing wrong with them, but maybe they need to get tested because they have to get onto a flight. They want to re-enter the workforce and their company requires them to
Right.
undergo.
Right.
So completely different reasons, right? The process can be different in the beginning for the two of them. For the
Hmm.
first category, if you're symptomatic, you should not be leaving your house. You should not be going into any facility to get tested because you'll infect others. In
Right.
that case, the process is, uh, for example, at Genepath, and this is true at other labs as well. You will call a number. You'll call the number. You make an appointment, and they will send somebody over to your home in full
Right.
PPE gear to go and take that nasopharyngeal, oropharyngeal swab.
Hmm.
Okay, they will bring that back. Uh, those swabs get processed through the PCR machines, and
Hmm.
within 24 hours, you get a result back saying you're positive or you're negative. If you're negative, there's never an issue. If you're positive, at least in Pune, since I'm assuming most of the audience is from Pune, but it's probably true
Right.
in most parts of India, um, the government, the PMC, needs to know, or PCMC needs to know in
Okay.
advance of you knowing. So
Right.
this is
Wow.
not something that private labs or government labs decide. This the PMC decides that they need
Right.
to know in advance
Hmm.
so that they can then appropriately figure out what has to happen. But as far as the individual is concerned, they will get the result typically in 24 hours. And then if it's positive, depending on your age and all of that, you'll be given certain criteria by the hospitals to either stay at home or
Right.
come in, but definitely get quarantined in whatever way, either at home
Right.
quarantine or hospital quarantine.
Right, right. Understood. There's
Right?
another confusion which was there about a month ago or so. So, to get tested, is a prescription, a qualified doctor's prescription required, or is it not? Is there a clarity on that?
Yeah, yeah. I mean, there is at this point in time, all labs are going down the path of no doctor's prescription needed.
Okay. Right.
Unfortunately, nobody seems to ever provide very clear guidance saying it
Very
is
true.
needed or it's
Very
not
true.
needed. In the beginning, it was clear it was needed. Now
Hmm.
that seems to have been taken off, which seems to suggest that it's not needed. But
Right.
nothing says a doctor's prescription is not needed. So
Right.
practically, what we are all doing is now no doctor's prescription is needed. And sort
Okay.
of going back to the other use case, if you are completely asymptomatic, which most people on this call probably are asymptomatic, and if they want to get tested, there, then you don't have to have someone come to your home to get your swab taken. Then there are
Right.
other options. You can go potentially to your doctor, or what Genepath has done. We have created this drive-through testing where you just go in your car or your two-wheeler or your rickshaw
Right.
to the location. You get swabbed, fill out some paperwork, and you're off. And 24 hours later, you can get your report through an online portal. So for the second category, there is no need to get people to your home and freak your neighborhood out.
Right, right, very true. And about the drive-through testing, it's a very interesting and a practical solution to testing, and we are going to get to it in a bit.
Yeah.
But before that, my next question is right now. So, what is like how COVID-19 tests are interpreted, and is there a correlation? Because this is what we've been hearing over the net or in conversations. So is there a correlation between higher CT value and severity of symptoms?
Yeah. So let me maybe provide some explanation on what things like CT value and all even mean. Okay.
Right,
Um,
right,
so the RT-PCR test, which is the gold standard, which is what most of the people are getting tested by, the way it provides a result is it doesn't say yes or no. It doesn't say positive or negative. It
right,
The way the thing works is it takes a small amount of virus that it may have detected in your swab and then goes through a number of cycles to keep amplifying it, to keep increasing the amount of virus to the point that it becomes detectable, right? Because remember, you're
right,
starting with maybe 100 copies, 1,000 copies, 10,000 copies of this virus, which is
right,
tiny, right? It's so tiny that nobody can detect it. So the way this PCR system works is it keeps doubling it to the point it becomes meaningful enough to be detectable. And if it's
right,
detectable, then you call it positive. If it's not detectable, then you say, okay, must be negative. And
right.
it goes through this cycle, of heating, cooling, about 40 times. And after
Okay.
40 cycles, where it's doubling after every cycle, after 40 such cycles, if you can detect that virus, it's positive. If
Hmm.
after 40 cycles you have still not detected that virus, even after trying to increase it, means it must not have existed in the first place, or might have been
Right.
so tiny that it's not discernible, right?
Right.
And so these cycles are called CT values, right?
Okay. Hmm.
And so what you would imagine is if there was a lot of virus to start with, okay,
Hmm.
then you don't require as many cycles to detect it,
Right.
right? Within 10, 15 cycles, you can start detecting it. If there was very
Right.
small number of a small amount of virus, it'll take 30, 35 cycles.
Right.
So sort of intuitively, the larger the number of cycles it takes, it means you must have had less amount of virus at the beginning,
Right.
right?
Right.
And
Of course.
so there has been this discussion that, hey, if the number of cycles is large, 35,
Hmm.
36, 38, means the virus was less, which is true in the beginning, which
Right.
means your issue of you don't have a very bad issue of COVID-19. It's
Right.
manageable. That's not
Right.
that's not true, but that is
Oh,
what is
okay.
believed. Okay.
Right. Right.
And conversely, if your CT value was small, which means it required less cycles to detect it, it means your starting amount of virus must have been higher. Okay,
Right.
means you have a more extreme case of COVID-19. But
Right.
what we have seen now, we have done about 14,000 patients we have tested, more than that,
Wow.
and we
Right.
have looked at data because we know for that patient what their CT value was. We know the severity of their symptoms if they were symptomatic.
Right.
and we found no correlation between
Right.
the two. And about 2 days back, right after the last time we spoke,
Yeah.
2 days back, the ICMR released
Hmm.
a note saying it is true, there is no correlation.
Right.
Okay? But for about 2 or 3 or 4 weeks before that, there was actually like various government circulars that said if your CT value is large, then you can quarantine at home. If your CT value is low, go to the hospital. But all of that has now proven to not be true. But this is the type
Right.
of thing that the community is learning,
Very
and
true. Right.
some things the community learns and moves on, but the WhatsApp messages keep floating around that are old, right?
Yeah.
And
Yeah.
that's why it makes it very confusing for a layman. I mean, I know if I was not in this space, the my version of me a year back, okay, would have believed all the things that I read, because what other way is there to believe it, right?
Very
to
true.
to be knowledgeable. And so yeah, it's a very dangerous situation if not clarified. And so I'm really glad you guys are doing this session.
Yeah, and that's exactly the reason why I wanted to ask this question in particular, because even though ICMR has released a circular, for that to reach to common people is going to take, I don't know how many weeks more, because
Yeah.
all these official circulars are never as clickbait as WhatsApp messages.
Yes,
So
that's right.
nobody's going to forward them. So, and
Yeah.
thank you so much for sharing all the technical details of testing in such understandable language. It's very important, and I hope our viewers have understood like a lot more about testing and what goes on in a testing center. For the next half of the conversation, I would like to invite Rupal Sancheti, a director of Healyos, to come on the stream. I'm just adding her. Let's all welcome. Hi,
Hi,
Rupal. Thank you so much for joining us.
thanks, Saurabh. Hi,
For
Nikhil.
the
Good.
Everybody.
next half of the conversation, I'm handing it over to you. Let's not let go of Nickhil so soon and ask him more questions that we all have had in our minds.
And a perfect beginning to your Sunday, Nikhil. Thank you so much. It's been really interesting. And as I've always told you, the simplicity with which you explain is amazing. And that's what our viewers will be taking back home. Much more understanding of the virus, of COVID-19, and a whole lot of things, right? Like Saurabh said, it's the first time we are understanding it in the perspective. Not to say that there's no knowledge around, there is overflow of knowledge, and we do not know what to make of it. And if the government is publishing their circular, you just can't read through it because there's so many things that you just don't know what to look out for. So I'm really happy we're talking to you. I want to get back to what role Genepath is playing in this whole COVID-19 situation. I know you've started and then this whole thing has happened and you are doing such amazing work. But for the audience also, I wanted you to tell us what is the role that Genepath is playing.
Yeah. So, Rupal, thanks first of all for uh, having me on this, because I enjoyed talking about this just because I know the value of,
Correct.
if I was on the other side, I would want to know this information, and it's not easily available.
Absolutely.
So, to the role that GenePath is playing, I think there are two parts. One, GenePath is a lab that processes patient samples. So, we all the way from collecting patient samples either from their homes or through the drive-through testing, we get samples, we process them, and we provide results back. We have a full-blown genetics lab, doctors on staff, and so that's one part of our business is a lab. uh, Second part is what makes GenePath really unique is in addition to being a lab, we are also an R&D facility that builds COVID-19 testing kits. Okay, this company has been around for 10 years, so we did a lot of other disease or disorders kits for them, right? That other labs can use. Now we are creating test kits for COVID-19, which can be used obviously by ourselves, but it can also be used by other labs. And this test kit of ours has also been approved by the ICMR. So it allows us to provide really high quality, low cost test kits. So any lab across India and across the world can use it to provide high quality, high accuracy test results to patients all over the world.
That's fantastic. And I think that's why we have been using the word path breaking in front of Genepath very correctly, right? If you are making the test kits and that's going to be available throughout the world, it's amazing. Which is my next question. You also started the country's first drive-through testing, and it's really interesting. You and Saurabh touched upon it. But tell me all about it. Are we going to have more centers in the city, state, country?
Yeah, no, so I think, this idea of a drive-through testing, countries like South Korea did an amazing job.
Yeah.
They had people, tested in huge amounts through the drive-through testing. And when we looked at our situation in India, we realized that one of the reasons that people don't want to get tested is because of that whole fear of how I will be viewed by my neighbors. Um, and so for asymptomatic people, we said let's get rid of that issue by having
Right.
the drive-through testing, right? That way that issue completely goes away. And so that was almost the motivation to start the drive-through testing. And we tested it out on a for a 2-week period to see how well it works, what are the things we have to put in place. And after we tested it out, we found it absolutely makes sense. And so starting earlier this last week that just went by, we have opened up our drive-through testing facility right next to Sancheti Hospital, actually,
Yeah.
at Sapphire, which is on that old Bombay Pune road. And people can drive through, get themselves swabbed, fill out some paperwork, and get a result in 24 hours. And and we're going to keep a close eye on how well this works. Yeah, so it will ensure that people have a great experience, and if this becomes successful as we believe it can be, then we'd like to open it up in other parts of the city, and then eventually look at whether we can take this outside Pune. But our first goal is make the current facility successful, and success is defined as consumers say it was a good experience and they want to share it with their friends. Second step is to expand to other locations, and then third step is move outside Pune.
I think that'll be so interesting. Like you rightly said, there's so much fear, there's so much stigma. If somebody in my building was to come in a PP's, suit, the WhatsApp messages are buzzing, saying
Yeah,
what happened, and who got COVID, how many got COVID, and if we don't have the right information, the maids always have the perfect information, saying konitari gela, konitari kaitari zala. So this
yeah.
whole thing the drive-through will really, really help, and the whole stigma around it, right? That gets me to my next question. How do you think more tests will make people panic more? Because sometimes there is a belief that I'm asymptomatic, I do not have anything that is stopping me from doing anything, so should I just self isolate at home and not do the test? Is that a correct view to go ahead?
Yeah, I call that the Donald Trump school of thinking. If you don't know, then it won't hurt you. But the reality, that's absolutely not true. uh,
Okay.
for a number of reasons. Number one is you may be completely asymptomatic. Let's say you are positive, you are asymptomatic, so nothing's happened to you. And there are people who fall in that category. Okay. And that's good for you. But there are two issues. Number one is, your family members may not be as lucky. Okay. Your friends who you hang out with thinking you are negative may not be as lucky. And so it is each of our responsibility to ensure that even if we got lucky, we can't, count on luck. It is our responsibility to ensure that people know that, hey, stay away from me. And how will you know if you have not got yourself tested? Right? I think that's one. And second, if a few days later you end up being symptomatic, because there are people who also take a while for their symptoms to show. Okay, for you to get into any hospital, you are going to require a certificate that says you are positive. Otherwise, the hospital won't even, or negative, or if you're positive, that's the only way they'll admit you into the hospital, right? And so, for a number of reasons, one, responsibility towards others. Okay. Now, there is a third school of thought which says, you know what? Uh, if I'm positive, without being tested, I just know I'm positive, I'm symptomatic, I'm just going to quarantine at home. Then what does it matter whether I get
Correct.
tested or not? Because in any case, I'm quarantining, I'm not hurting anybody else. But the issue with that scenario is you may have already before you got the symptoms, have exposed others to it. And so if you really are positive, you have to let others know that maybe I'm positive, please, you should go get tested, right? And so for a number of reasons, I think the right thing to do is get yourself tested. And of course, you should still go ahead with the quarantining and all of that. But not knowing, I don't think is a good answer.
That's a very good answer, that we need to know it's our responsibility. But just, the fear and the stigma, like after AIDS, how the whole HIV thing was, people have that stigma ki, oh my god, COVID zale. So how do you think we'll streamline the whole COVID testing so that people are okay? Yes, I've got affected with the virus, I'm going to take care, I'm going to take whatever it is, but the first step is, how do we streamline the whole COVID testing process? Is it streamlined right now in the country?
Yeah. No, I think, probably there are two parts, Rupal, to the answer to your question.
Mhm.
One is, how do we streamline the process so it becomes simpler, right, for people to get easier access? And second is, how do we overcome people's fear, right?
Yeah,
Because one is a process that assumes that people will do it. Second is getting people to actually do it by
getting it.
overcoming their fears, right? And the first part, I think things like the drive-through help a lot, right?
Correct.
Making testing, more accessible will help, right? But the second part about how do we help people overcome fear, I think there, I have a viewpoint, right, which is the 40%. I mean, these numbers keep changing, but about 40 to 50% of the people who have it, who get COVID, are positive, are completely asymptomatic. Okay,
Right.
so for those people, uh, there is no downside. I mean, you just want to know, you want to let others know, but nothing has happened to them that's sort of affected their health. Okay,
Right.
of the other 50% who are symptomatic, there are people with weak symptoms, medium symptoms, and then of course there are people who have a very bad time and some die. And it's that last 5-10% that I think people have at the back of their head.
Yeah.
People don't assume they're going to be in the 90% that are completely asymptomatic or mildly symptomatic. They assume they're going to be in the 10%. And that's what creates panic. But I think the more we realize that, first of all, there's a 90% chance you are not going to get badly affected. And so
Correct.
in that case, by getting tested, by following all the norms, by being careful, you'll really help yourself and others. And if you do unfortunately happen to be in that last 10%, the sooner we find out that you have it, more that anything can be done about it.
Correct.
Right? There are too many
Absolutely.
people who wait too long, and then this disease is still, people are still trying to figure it out, right? It's not like everything is known. And so, but the number one thing is to know sooner rather than at the last minute when it's, much harder to do something about it.
So I think again it gets us to the point that get tested. Do not wait for longer. Just go ahead and get it tested. The drive-through facility, whatever it takes, go to a good good lab which has sensitive results and just go ahead and get yourself tested. Which there is a whole lot of information. The medical fraternity, of course, knows a lot of facts about the COVID-19 virus, but there's another fraternity, which is the media, right? The media talks about it all the time. We open our online news or newspapers and things like that, and they talk about asymptomatic carriers, they talk about surface transmission, they talk about mortality rates, and it's just very confusing and again scary. So can you throw some light on this?
Yeah, I read a meme recently where somebody asked a doctor, so how do you think this is all going to pan out?
Right.
The whole COVID-19. He said, how would I know? I'm not a journalist. So, yeah, so I think, there is a lot of misinformation. And then within that misinformation is hidden some good amount of information. And the trick right now is to figure out how to, separate between real news and fake news. And leaving that to every individual to figure out, I don't think makes any sense, right? I think having forums like this help a lot. I would love there to almost be like a call-in number where somebody picks up the phone, calls the number, and there are you can ask questions you are convinced or sort of confused about, and
Correct.
get an answer, versus doing your own research. And like I said, each person doing their own research is not a very productive use of anybody's time, right?
Correct.
uh, so for example, there is so much about the different medication, right? All the way from Ramdev Baba's, amazing medication that cures everything, to some candidates that are actually in the works,
Right.
that are showing some sort of hope. But the reality right now is it's still a disease that's being managed, right? And even amongst the medical fraternity, there are differences. For example, this MMR BCG
Correct.
studies. There is a lot of studies still going on. There is no conclusive proof either way, right? Um, Similarly, hydroxychloroquine and all of this, right? This is doctors in India. They swear by it. They believe it helps. Doctors in France believe it helps, but rest of the countries outside India and France are not yet seeing any results from it that are conclusive. And so it is there is truly things that are even confusing for the medical community. um,
Right.
and so it's an area that we have to be very careful about reaching conclusions just because it'll make us feel good. I think if a conclusion is not reached, then it's important to know that there is no clear conclusion, and know that you may be sort of like an experimental candidate for that, versus believing, okay, this is going to change everything, right?
Correct.
And I think the best thing you can do is talk to your doctor, or on forums like this where there are people who know what they're talking about, and get an answer. But try avoiding reaching conclusions based on what you read in the newspaper, because it's all over the place.
But with everyday natural things that you can do at home, everybody's doing something or the other, to gargling, to steaming, to hydrochloroquine, to Ramdev Baba's thing, which he had a big press conference for, to even camphor. Everybody is ready. What I've noticed is that people readily believe and can consume it, but everything is changing every day. So we
Yeah,
do not know what's happening. We need to ask the authorities, but sometimes I feel the authorities also don't know too
yeah,
much.
yeah,
Everybody
yeah,
is trying to figure it out on the go because nobody's been exposed to something like this as crazy. Which then I think everybody wants to rest on the fact that we hear the vaccine is going to come. The vaccine is going to come. So what do you think? How far along are we? And do you think that's the best thing that could happen to us? It's going to cure everything, or is there some caveat to even that?
yeah. So nobody knows the exact answer, but I can provide my viewpoint. So before I talk about the vaccine, I think, to answer your previous question, Rupal, in terms of what are we doing, right? Like as a family member, as a family, uh,
Yeah,
I think we're just following some basic safety and hygiene, right? Wear a mask, wash your hands. If you are going to meet with people, keep that social distancing. Um, Nothing that is out of the ordinary, but
correct,
simple things like that actually help a lot. And so I would say, avoid experimental things, because we have no idea what the downside of that could be, right?
correct.
um, do the basic things, and that should go a long way towards helping. So that's the first part. Now to the vaccine, the thing that's going to that everybody is waiting to hear, what is going to happen, and the results on the data on that keeps changing on a day-to-day basis, because these vaccines have to go through a pretty thorough process. In the history of mankind, no vaccine has ever been developed in less than 4.5 years. The
Yes,
fastest was 4.5 years. We are trying to accelerate that process dramatically by getting it out in a year and a half or year. Okay? And that is going to come with its own risks, because when you try to accelerate something that naturally takes longer, there are downsides. But you have put the best brains in the world together, and they're working on it. So that's good. But having said that, here are some thoughts or some observations I have around the vaccine. Number one, I don't believe anything is going to come out at least until the first quarter of next year, right? So
okay,
Jan to March timeframe. Second, even if it does come out then slightly earlier, slightly later, whenever it does come out, uh, it's not going to be accessible to all of us. They will first roll it out to people who are absolutely on the front lines, okay,
Okay.
the healthcare workers and so on. And by the time it reaches most people, we are talking about another year after that. Okay, it's a long way to get 5 billion doses out. Um, so if you are like most of us, if we are not at the in the front lines, we should expect to wait a while before we get it. Okay, just practically. uh,
Okay.
because every country is going to fight for that same amount of number of doses. So there'll be
Absolutely.
this whole quota system. Then within a country, it'll be a quota system by profession. So practically, it's going to take a while. Third observation about the vaccine is no vaccine is perfect. Okay, it if it was perfect, then everybody who gets it is going to not have any side effects and is going to get protected. There was, I think, a couple of days back, there was an interview with Dr. Fauci,
Mm-hmm.
the the guy in the US who's sort of the face of this, and he's very knowledgeable, has been in this space, and of course, he also claims, right, that he doesn't know everything about it, which is true. He doesn't. Nobody does.
Yeah.
But one of the interesting things he had to say about the vaccine is he said that his hope for the vaccine is it's 70% efficacy, which means that 70% of the people who get it will actually be protected. Now, that also means that 30% of the people who get the vaccine are not really going to be protected. And the challenge is you don't know whether you fall in the 70 or you fall in the 30, which
Yeah.
means that even if the vaccine came out and you got it, you have to still be careful because you might be in the 30%, right?
Absolutely.
If we get super lucky, it'll have better than 70%. But he said his hope is 70%, right? Uh, so that's the third part. And the fourth part is any vaccine, when it comes out, it has, to come out, it has to go through what is called the phase 3 trials, where it is tested on hundreds of thousands of people. And
Right.
that's how you get to see sort of the range of reactions, right? And there are these things called that have there are it's called a certain technical term, but effectively what it means is some people can have a negative effect to the vaccine as well, right?
Right.
And that's why they do these phase 3 trials, so they know what the scope of that negative effect is. Is it a 0.1% issue? Is it a 5% issue? And so lots of things have to happen, but I think it's important for people to keep these 3 or 4 points at the back of their minds, knowing it will still take some time. It's not going to happen next week, next month, or next quarter. It will take a while, even if it came out, to get to you. Uh,
Correct.
and it is not going to be 100% in its efficacy. And so you have to always remain being careful. And the ways to remain careful are not that hard.
It's truly not hard. I think your point is well taken. Where we all want to listen to other Poonawala making some statement, but we are a bit of a while away before it can come to the common people. But what's simple is to practice social distancing, the mask, the sanitization. It's not.
Yeah.
I see that okay, people wear masks, but sometimes slowly, they get like, okay, I know these are my friends, but we
Yeah.
don't know because there's not much testing happening. So I think a responsibility for all of us to get tested through the easy facilities. I think the audience has a lot of questions for you. Thank you, Nickhil. I'm going to pass it again to Saurabh
Sure.
and he can take some of the audience questions. But lovely. Thank you. Saurabh?
Thanks, Rupert.
Thank you so much, Rupal, for your time. There were really interesting questions, I guess, all of us had in our mind, and that has given a lot of clarity to people who are listening today. So thank you so much for joining us.
Thank you.
Nickhil, again, we're just going to take a few audience questions.
Yeah.
Start with okay. So Namrata has a question. So people get coughing, fever, and headache after they get tested. Is it same with everyone? I'm not even sure if that's a fact.
I mean, on a one-off basis, there may be people who get it, but that should have nothing to do with the testing.
Right, right.
It may have been independent, or somebody, whoever took the swab, did a really, really bad job and caused the issues. So if it happens, it's a one-off, and it could be completely coincidental or a case of a badly taken swab. I don't know what the reasons could be.
Right, right. Perfect. I hope Namrata that answers your question. Uh, then we have Okay, this is a very interesting question. So, what is the percentage of getting false positive test in asymptomatic cases? I guess all of us have this question in mind. What if I get tested and it's a false positive?
Yeah. Yeah, this is an interesting question because tough to quantify this. Um,
Right.
but what we have found is, on in general, when we tested symptomatic people,
Hmm.
a big percentage of them ended up being positive, really positive. Okay. Uh,
Hmm.
but because depending on the test being used, uh, the number of false positives could still be high, right? Even in a
Right.
symptomatic case. Okay.
Right.
Uh, so as far as the test mechanics are concerned, there is no reason why the percentage of false positive for a symptomatic will be different from asymptomatic. Okay.
Right. Right.
But what that percentage is, in many ways, depends less on whether it is symptomatic or asymptomatic, and it depends more on the quality of the test being used. Right.
Right. Right.
So even within PCR tests, like I
Hmm.
mentioned right at the beginning, it's
Right.
important to go get yourself tested at a lab that has a reputation for providing high quality. Because I'll tell you practically what happens. Practically, a lab is going to buy a test kit, okay, and use it
Hmm.
for their PCR test.
Right.
Now, these test kits, like everything else, can differ in quality and price.
Of course. Right.
So if a lab has a good reputation and wants to do the right thing, they will buy the test kit that is the best quality, independent of the price.
Right.
Okay? And the moment they do that, the false positives go down dramatically, right?
True. True.
If, on the other hand, they are trying to run it like a business as every lab should, but to the point of hurting consumers, then they will buy a cheaper test. Okay.
Right.
You buy a cheaper test, you are guaranteed. In fact, we have looked at all types of test kits and we have seen the difference between using a good test and a bad test kit, right?
Right.
Can be the difference between like minuscule, like 1% or less false positives to as high as 50% false positives or false
Right.
negatives. The bigger challenge is false negatives, right?
True.
Uh, Today, false positive, is a bad thing, but what will you do? You will go and unnecessarily quarantine. But a
Right.
false
Right.
negative is a much more dangerous situation because you
True.
don't think you have it and you walk around infecting people. And
True.
the issue with a bad test kit is the false negative. False
Um,
positive is not as big an issue. And so the only thing I would say is, there are quite a few reputed labs. Use them.
right.
Obviously, Genepath, we pride ourselves on doing the right thing, but there are others as well who are good. But
Right.
do not go to a fly-by-night lab because then the false negatives and the false positive, everything is a challenge.
Right, right. I guess that's a very important point to for all our viewers to note that make sure that you're going to a reputed lab to get yourself tested because otherwise you'll always have that sword hanging over your head. It might be a false negative or a false positive.
Yeah.
Very true. I'm just taking another question. Okay. So we have a couple of questions on the same line. So if I have met someone briefly who has tested positive later, should I get a test done even if I'm asymptomatic?
Yeah, this is an excellent question because it's a very practical situation. We have seen thousands of cases like this.
Right.
So the what we recommend is if you have met someone who's tested positive, even if it's brief, right? Um, Wait for about 3 or 4 days because
Hmm.
it takes that much amount of time for it to show up in a test.
Right.
So if you met
Right.
somebody yesterday, maybe in 3 days from yesterday, go in and get tested,
Right.
even if you're asymptomatic. Uh,
Right.
for all the reasons we spoke about earlier. But
Right.
whether you're symptomatic, asymptomatic, if you're symptomatic, of course, as soon as you feel the symptoms, go get tested. But even if you're
Right.
asymptomatic, get yourself tested, but with about a 3 day difference between the exposure and when you go get tested.
So very important point to answer your question, Karishma. So even if you don't have any symptoms, wait for 4 days at least. Otherwise, even if you might be positive 2 days later, if you're going to get tested, immediately it will show as negative.
Correct.
Okay. Just okay. All right. So if someone has tested positive and has recovered, can he get infected again?
You know, the this is amazingly loaded question and a good question, because the standard answer has for a long time been no. But we have
Hmm.
seen in our own group of people we know, where
Right.
we have done the testing, we have seen them in action, they were infected again. So in this example, the person was tested, he tested positive, okay,
Right.
was quarantined for 2 weeks. We tested after the 2 weeks, they tested negative. Okay. We then tested them with the antibody test. Remember, the antibody was to tell
Right.
you whether
Yes.
you had it or not. And
Yes.
that turned positive, which was correct because that
Right.
person had it, which means the person had developed antibodies and it all made
Right.
sense.
Right.
About 4 to 5 weeks later, this person complained again of symptoms. This time they was first time they were asymptomatic. Second time they
Right.
were symptomatic. Okay.
Okay.
Slightly, not very severe, slightly symptomatic. We tested them again with the PCR test. Okay. Again, they turned positive.
Wow.
Okay?
Okay.
And then we tested them with the antibody test again, right? And it was negative, which means in those 4 weeks, at least for this specific person, okay, the antibodies had gone. Okay.
Wow.
Now, this is by no means meant to say that this is a standard behavior, but
Right. Of course.
what it really shows is that there's a lot of things that are very person to person dependent. Okay,
Right.
and that's what makes this thing so unique. This specific virus. Some people it affects their their heart. Some it affects their respiratory tract. Some it affects something else, and some it doesn't affect at all. Then within the people it affects, some most show antibodies for a reasonable period of time, but some
Right.
don't show it, some show it gone. And
Right.
so even when the vaccine comes out, okay, one of the things that will be uncovered in these phase 3 trials when they do it
Hmm.
across hundreds of thousands of people is what is that range of
Right.
reactions. How long do the antibodies last? And of course, it's not just about antibodies, right? There are these T cells, and there is a lot of other things that are
Right.
being evaluated. But right now, the easy answer to the question is yes, they can get infected again.
Right.
Probability seems low, right? But it's not like then it's not going to happen again. That is
Right.
can clearly be said is not the case. It's only a question of how many people will fall in that bucket. That is
Right.
unknown.
Right, right. And I guess the takeaway from that answer is just getting positive once and getting recovering from that doesn't give you a free card. There is a possibility that you might get contracted with the virus again, and it's important that you should take all necessary precautions even after you have recovered.
Yeah, one interesting or unfortunate story is in the US at least there were these COVID parties happening.
Oh
Okay,
yes, yes.
where people would go to the house of a person who had COVID, so they could all
Right,
get it and get it out of the way,
right,
so to speak. And unfortunately, for many of them, when they were very symptomatic and some died, right? That was one
right,
issue that it was why it was unfortunate. But the second issue is then after they got it, many months later they got it again. So I don't believe any of the viewers of this are probably going to go for COVID parties, but if you're even thinking about it, don't.
right, right. I guess it's always a good idea to put this warning out there. Please don't.
Yeah.
All right. So, okay. Is that's I'm just taking one more question. You see if so how do we deal with calling electricians and plumbers for repairs at home? How should we sanitize after they have left the house, considering air transmission is possible?
Yeah, this is again a practical question,
Right,
and so I think the only thing you can do is make sure they're wearing masks, you are wearing masks, you
right,
keep them constrained to whatever part of the house that they're working in. If they need water or anything else, like provide it over there instead of everybody walking around all over the place. And
right,
after they're gone, sanitize, like wipe down the place, right?
right,
At this point, I would say it's better to err on the side of being more cautious than less. Uh, and there is just that's sort of what I would recommend if that's possible. Air transmission all is possible, but again, if you're wearing a mask and unless they're like sneezing away like crazy, then don't let them come into the house. Uh, but
Got
uh, but yeah, I would say wearing a mask and following just basic sanitation, I think, should be enough.
Right. So we're getting a lot of audience questions, but most of it you've already answered through the conversation. So people who have joined in late, I would suggest you can always scroll back and start watching the conversation over again because most of the questions Nikhil has already answered. Uh, Thank you so much, Nikhil, for taking the time out and enlightening us and giving us the all factual and relevant information which most of us were not aware of about COVID testing because we always was just looking at numbers, how many tests are done, how many people are positive, what's the death toll, but we didn't really know what's exactly happening with the test and what the process is. So thank you so much once again for joining us today and giving us a lot of relevant and factual information about COVID-19 testing.
Yeah, you're welcome, Saurabh. Thank you for having me. And I would sort of end by saying, it is something that people are still trying to figure out in the world. It's not a known. But again, no need to panic. Get yourself tested at a reputed lab. Follow basic, principles of social distancing, wearing a mask. It sounds very like preachy, but the reality is it's so easy to do, and it does
True.
help. um, every state or country that has followed it well has shown the results. So don't panic. Do these basic things, and if in doubt, just ask somebody that you trust. Trust from a medical point of view,
Right.
and they might not have all the answers, but they'll have more right answers than the friend who claims that they know but may not actually know much.
Very true, very true. And to for everybody in Pune, I guess we are lucky that Genepath Diagnosis is there in Pune, and they have started with the drive-through diagnostic centers. So at least for viewers from Pune, in case anybody you know or any friends and family have to get tested, that's I guess the safest way to get it done because it's a very practical solution against the whole fear and stigma against going in a center or calling people to your home and PP kits and getting tested. So thank you so much once again, Nikhil, for joining us today. It was a very informative session. I have really enjoyed the whole conversation we have had over the past hour.
My pleasure, Saurabh. Thank you.
Thank you. Thank you so much. And thank you so much for joining to all our viewers. Uh, do follow Healyos India and Sancheti Hospital India. We are going to keep coming with more and more episodes in the series that we've started, the Frontliners. We will get such prominent personalities who are leading the charge of COVID 19 management from the front lines, and we will keep getting more factual information to you because right now, the most necessary thing that we need is more and more knowledge about the whole pandemic, and that's what we are going to bring to you. Thank you so much for joining us today.